Well, I'm going to go ahead and get started because we have a full agenda and two of our special guests. Thank you to each and every one of you for participating in this event tonight from 6 to 8. I'd like to thank all the allies and accomplices. That's what I call you all, the allies and accomplices to racial justice and social justice. So give yourselves a hand and thank you for being here. Thank you so much. Just a little welcome to introduce you to, I am Kevin Washington. I am the chair of the Human Relations Commission for the town of Windsor. On my team of commissioners are Joyce Armstrong, Byron Bob, Max Kuziak, Patricia Mack, who is vice chair, Kareem Miro, Desiree Primus, who is secretary, Leonard Sway, long member, myself, Joshua Amaro, and Ms. Rebecca Jacobson. If the commissioners are on, if you just wave to let people know who you are, that'd be appreciated. Thank you so much. Also, I'd like to recognize our partners in this work, which are Grace Church, First Church, Archer Memorial, Windsor Public Library, Windsor Historical Society, and Bay Path University in Massachusetts. So I'd like to give them a hand for thanking them to be a part of this as well. I'd move forward in stating that in addition to being a serious social issue, racism is also a serious challenge to the public health. In fact, over the last year and a half, dozens of cities have declared racism a public health crisis. In fact, health professionals have identified racism as a public health issue for well over a decade. Both the COVID-19 pandemic and the recent killings of Black people have brought renewed attention to the ways that systems and institutions disadvantage people of color, especially Black and Latino Americans. How does that relate to public health, you ask? Because you are where you live. Racism helps explain why people, Black and brown patients, experience the worst health outcomes than Euro-American counterparts in nearly every category, even as they move up the socioeconomic ladder. Chronic health disparities persist between Black and white people in the United States. To a great extent, while health disparities have narrowed since 1999, the latest available data shows that Black people in the United States continue to face higher rates of chronic disease compared to Euro-Americans. That being said, those that experience the most disparities are in the fields of presenting asthma cases, cancer, stroke, and heart disease, which contributes to diabetes and hypertension. Black women are nearly 4 times as likely to die of pregnancy-related causes than white women. Black men are more than twice as likely to be killed by police as white men. Black people are more likely than white people to experience high blood pressure, diabetes, and stroke. And they're more likely to die at early ages of all these causes. Racism has been killing people for a long time. Jeffrey Sanchez, a public health advocate and former Massachusetts state representative, said that COVID-19 pandemic perfectly encapsulates how racism manifests public health. Black and Latino Americans who get infected are more likely to have pre-existing conditions that increase the risk of severe illness, according to a report from Johns Hopkins University. Because they're more likely to be uninsured, they tend to put off seeking treatments and are sicker when they do receive care. On top of that, they tend to receive less aggressive treatment than Euro-Americans. The report states at home, crowded housing conditions make it harder for Black and Latino Americans to practice physical distancing, and many of them work in essential jobs that can't be performed remotely. Experiencing racism may harm cognitive health, study finds. Racism has been killing people for decades. Now I just ask you to tune in and watch these two videos coming up, and then we'll get into introducing our guest panelist and my facilitator.
All right,
Thank you.
good. Thank you so much, Kevin. I'm going to share my screen. I'm going to ask for a thumbs up to make sure that you all can see what I see here. So we, as Kevin said, we're going to watch two snippets here around the topic of racism and public health. All right, here is the first one. I'm going to share my computer sound. There we go. Good.
For it to be noted that the conversation that's happening nationally is a very important one, but the circumstances aren't new.
Defund the police! No more pigs in our community! No more pigs in our community!
They walk to express to the nation in a peaceful fashion their rights.
We're traumatized just by the systemic fact that we've been under oppression for over 400 years. And though we may not be on the bottom of boats anymore, but we certainly at the bottom of education. We may not be in the cotton fields for free labor, but you're certainly getting it from us now.
It all just comes down to that we're in a state of emergency because Black people are dying.
Clearly, I have missed the boat in some way as an elected leader. I recognize that. I now need help fixing that.
This resolution affirms that racism is a public health crisis that results in disparities in family stability, health, and mental health wellness, education, employment, economic development, public safety, criminal justice, and housing.
All those in favor?
Aye.
16 yeas.
This will finally give some teeth to some things that we've been working on here in Milwaukee County for quite some time.
It's 0 no's. The item is received and placed on file.
When you make a declaration and you tell people this is a crisis under CDC guidelines, now you have to do whatever you can to mitigate the crisis. We look at this as racism being the other pandemic that we're experiencing right now.
And really felt we've come to a cultural and societal moment where it is just pivotal that we say collectively, racism exists, it's been wrong, it's wrong now, and we have to join together and do everything we can to eliminate it.
And it's unfortunate that an event and a circumstance such as George Floyd had to happen for them to shine even, a light or get a closer lens into what disparities are affecting Black Americans. If we do not address this moment now, Black people are going to continue to remain in that cycling of suffering.
What I brought to the table on this was, let's not just do a resolution, but let's have a plan for work after we pass it. And that's where I said, let's create an element group of the countywide vision to really dig into and work on the topic. And our shared goal is to identify, eliminate the effects, and prevent racism.
It was all 5 yeses and no nos. I was excited, but then right at that moment, I couldn't celebrate too hard because I said, well, there's still work to be done. There's still work to be done. This isn't just a resolution. This is on paper, but we got to make sure that there's actionable steps put into place. This cannot be performative.
And in the 53206 zip code is a zip code that's nationally known for being the most incarcerated in the world. Wisconsin has been named the worst state in the nation to raise a Black child. I think it only made sense that we were the first to declare this a public health crisis. I'm proud. We created a vision statement for the first time in 20 years. This hadn't been done in 20 years, and our vision is very simple. We want to make Milwaukee the healthiest county in the state of Wisconsin by achieving racial equity. And that's what led to our racial equity ordinance, because we wanted to institutionalize this work and really make it law.
Everybody feels like it's time for government to take the lead to call it out. So as we come out of this COVID-19 crisis, we actually have to come out of this better than we went in.
I believe part of the challenge is going to be making sure we stay at the table and stay actively engaged and know that this is a marathon and not a sprint. that the work that we've accomplished on yesterday, I may not be able to see the full benefit of it, like Dr. King and Malcolm X and Medgar and the other our other heroes were not able to experience and enjoy some of the things that we're enjoying. But I believe my grandchildren, my unborn grandchildren and great grandchildren, and others will benefit off of the work that we started yesterday.
When school. All right, and then there's our first video. I'm gonna go on to the second one here.
Our question is, how do we know that racism is affecting the health of people, all people in our country? I believe one of the things we're seeing, and particularly in primary care, is an increase in anxiety disorder and those pathologies associated with it. Hypertension, poor health choices, lifestyle problems, obesity, binge eating disorder, these kinds of chronic problems that we can no longer afford as we're also beginning to have economic stresses on our healthcare finance. We have a campaign pushing back against the government or the Centers for Disease Control and Prevention to force them to do what they're empowered to do, which is prevent and control disease for the public. I believe racism meets that 4 criteria that they have for that threat, and we're trying to ask them to do their job, particularly now that we have evidence that it's directly related to everyone's health, not just the health of people of color. So CDC has 4 criteria for what constitutes a threat to public health. One is that it's a burden. It's an economic burden on the culture. The second is it's disproportionately shared by a section of the population, whether that be female, gay, pregnant, smoker. But the other is that it shows that current measures are not enough. So in other words, that problem is continuing despite what's being done currently. And the last one is that there's evidence that upstream change will affect that problem. In other words, institutionality, the institutional problem of it. What we're saying is racism meets those 4 criteria. So we're asking that CDC do their job, declare it a threat to public health, and then follow the protocol just like did for other public health problems in the past. Zika, HIV, smoking, diabetes, these other campaigns. The way that we want to do that is it needs to be effectively, definitively, and publicly announced as the threat that it is. That way, people can then begin to speak about racism and less about health disparities, social determinants of health, these other code words that have currently been used. We are saying if CDC will do that, we will begin to save the disproportionate number of healthcare dollars, lives, unfortunate incarceration, gun death. So much of the underlying cause will be mitigated, and that money will be saved and put into education, healthcare, the kinds of things that we now know have been neglected instead. Because in primary care, the idea is not just to treat the symptom, we pursue the cause of the symptom. It seemed only reasonable to apply that to this particular inequity. As time has gone on, we've begun to see more and more how that same underlying cause, racism, also harms people who are not marginalized, people who are not targeted by these inequities. We want equity, health equity for our entire population, and for CDC to recognize those 4 criteria and realize it's not a mental health problem, it's not a political problem, it is a public health problem. Handle it.
All right, so those are our 2 videos. I know, Kevin, you'd like to introduce our folks today?
Yes. So I just wanted to add to that the CDC, many of you know that I work hand in hand with the CDC. It is being looked at as a mental health diagnosis, and there is depression and anxiety and everything involved in that. So that is an ongoing study that we're doing as a part of the CDC as well. And if you're not familiar with the acronym, it's Centers for Disease Control. This is considered a special conversation on race because it's within the month of Black History Month, which ends today. but Black history is everyone's history. It's not just Black people. So it involves all of us as Americans. And it behooves each of us to read, get involved, ask questions. So I'm asking you to please participate, because I will call on you. But I want people to feel comfortable in conversation, ask questions, respond. If there's something you don't understand, you're in a safe place. And I want you to reach out to any one of us. Panelists or questions of each other are perfectly okay. My first very special guest that I'd like to thank for being here is our own hero, town hero. I call her a town hero because she is. And she's none other than our town councilor, Yvette Burke. Mrs. Burke, thank you for being here. I appreciate you so much. And our other special guest is our fairly new Windsor Historical Society Executive Director, Mr. Douglas Shipman. Thank you for being here as well, sir. And each of them, it's kind of an interesting conversation because we're speaking about the proclamation that was passed back in June. And we're also speaking about the Windsor Historical Society's project that they brought forth. So we will have an interesting conversation. And our facilitator for the evening, our co-facilitator, is none other than Ms. Cassie Copeland. She is such a wonderful young lady. And I thank you for being a part of this and doing this on behalf of the Human Relations Commission. I will hand it over to you, my dear. Thank you so much.
Awesome. Thank you so much. So I saw some folks here in the comments might like to have access to the videos we watched. So I popped them here. If you'd like to rewatch them, go for it. All right, so before we get into our conversation, it is great to establish some conversation guidelines. So I'm just gonna kind of go through a couple of these. Now we have these here in place, these guidelines, to really help us create a safe space. It's one thing to say, oh, well, this is a safe space, but it's another one to create it so that you actually feel it. So that when everyone's in here, it's like, oh, I can open up if I choose to and have these conversations together. All right, so the first one is you want to speak from the I. So speak from your own experience, not the he said, she said, well, over there they said, over all these different things. Speak from your own experience. The next one here is listening to understand one another. In our world, we are often consumed with technology and reading all sorts about all different things here. And it's easy to kind of get lost in, I need to have a right response. Like maybe this person will like me more if I respond in the way that they want me to, right? So in this conversation, we're going to set that aside and we're going to really lean in and listen to understand what we are saying to one another and how we're saying it. And this kind of leads into the next one where we want to lean into our own discomfort. There might be a point where like I might feel uncomfortable being like, oh, I've never talked about racism as a public health issue. I might feel uncomfortable because I may or may not have had these types of experiences, right? So kind of lean into that to understand yourself and others around you better. Then we have confidentiality, or the Vegas rule, right? So everything that happens here stays here, meaning all the stories and everything, people might be sharing some of their own stories, that stays. But the moral, that lesson that you learn, that's what you take back out into your community, whether that's the town of Windsor, whether that's the school you work at, whether you go into your workforce, into the job, wherever those circles and spaces are, that's where you bring that lesson back into. We have be respectful. So online, it's kind of different. You know, in person, it's just kind of make sure you don't talk when others are talking. But online here in the Zoom, it means staying muted while someone is presenting or speaking. You can also use the chat function. So if you go to the bottom of your screen, or you will see that there's a little chat bubble. If you're coming from an iPad or an iPhone, you'll see 3 little dots. If you click on it, then the chat will come up and then you click on that as well. So it's another way to participate. And finally, as Kevin said before, participate and converse, meaning that this is a challenge by choice activity. I'm not going to force you to talk, but if it would really add to the space if you challenge yourself to speak up and out, whether it's in the chat, whether you raise your hand or make these connections with one another. All right, so that's kind of our conversation guidelines that we have for our event tonight. Just a brief, quick agenda here. I'm gonna go over and highlight a couple of pieces that the videos we watched talked about. Then we're gonna get into our panel discussion. So I'm gonna start off with Nushette, then go to Doug, and we're gonna kind of play off a couple questions. After every 2 questions, I will be opening it up to you all to have you all share what your thoughts and experiences are. And then we're going to get into our next piece around a really cool project that the Windsor Historical Society is doing. So can't wait to get into how history really impacts racism as a public health issue now, right? So seeing kind of who we are and the roots of that and how that's taken shape over time. And then finally, we'll close out with some final remarks. And I have optional homework because I'm a teacher, so I always have homework at the end of the day. Excellent. So that's our kind of schedule for today. I'm going to share my screen here so we can get started here. So I just have a brief couple of slides here. I'm mainly just going to have it so that everyone here is on the same page, right? So the purpose of tonight's event is to converse with one another on why racism is a public health issue and to discuss what types of community actions we can take to better support one another. I know in the video that there were all these different experts and community members talking about that, but now it's our turn. It's our turn to step up and be there for one another. So the video talks about racism, kind of boiled down. Racism is often confused with prejudice, meaning that like, oh, well, someone might comment about me as a woman and then I might mistake, oh my gosh, like they're talking about like this other part of my identity, right? So I really just want to have a clear line of racism is the belief that race is equated with particular traits, that some races are superior to others. In our culture, in the American culture, we see that as within white people having more privilege than Black, Indigenous people of color. And prejudice here on the other side, although it's kind of similar, the main difference here is that it is a preconceived opinion of another person, not based on reason or experience. If you look in the word itself, it's prejudge. You are prejudging someone, not based off of fact or anything. I might have my own bias being like, oh man, I watched that movie and now I think I might have that perception about this whole like race or sexual orientation of people, right? So I'm just making that very distinct here because we will be talking about racism as a public health issue tonight. Whoop, I'm gonna go back one. So what is public health? In the video, they briefly go over that. But it is really kind of, when you boil it down, it's a lot of different things combined, right? It's about protection, prevention, and promotion here. And there's a lot of different factors that go into it, such as the environment, such as workplace, such as all these different things. So all together, this is what makes up public health. And I have this video here. We're not going to watch it today, but I will be sending this out at the end of our presentation if you'd like to explore what does public health mean. But when you boil it down, it's about the health of the public, because we, the people, are the public. So we got to be concerned about our well-being physically, mentally, and emotionally. All right, so there's a crossroads here of racism and public health. Racism has a mental, physical, and emotional toll on Black, Indigenous people of color. This specific terminology is called weathering. And when you look at weathering over time, whether it's from like your own life or from those before you, that can cause generational trauma. Meaning that this can be seen over time, over centuries of time. I have some ancestors here who have gone through lots of racism and a lot of different social injustices, and that took a toll on them physically, mentally, and emotionally. They were weathered, right? And we can still see that today, not only in COVID times, but regardless of COVID times, that still happens here, right? With increased rates of mental health issues, treatment, and the politics of who deserves to be treated. Because when we look at who gets what first and who deserves to be treated based off of what, and in our society, that's usually based off of, oh, well, if you're of this racial background or if you're of this kind of class status, you get to go first, right? So we're really gonna kind of get into this a bit more today. And finally, here we have our long-term side effects, because you know, we know that this is an issue, but people don't understand how over time it has an impact, right? This leads to the mistrust of medical professional staff after centuries of experimentation without anesthesia, such as a lot of African American people and former slaves were used as experiments. So if you look at our gynecology nowadays, historically, it was people of color who were experimented without anesthesia. Also, that sense of not belonging, right? Being like, oh, well, you're over there, still feeling the side effects of Jim Crow even after it's been abolished, right? So that sense of not belonging, or having their pain seen as, oh, well, it's not too bad. Did you make it up? Or, oh, well, maybe, like, I don't know. So when we look at this as a public health issue, they make it more about you instead of about us, we, the community, right? And finally, seeing how our identity is developed around others' perceptions instead of us understanding it ourselves. Like, how can you get to know yourself if everyone's saying, oh, well, like, this is who you are, this is how we need to treat you within our, like, medical society or our culture, because this is just the way it is, right? Based off of who we perceive you to be, right? So how do you know who you really are? Right. So we're going to really hone in on racism as a public health issue because it is, right? And finally, we kind of see, again, there's a lot of what we call intersections, meaning there's multiple issues going on here, such as racism, the mental health side. There's chronic disease, as we saw talking about in the video, social exclusion and isolation, which has only been heightened by COVID-19 pandemic, and collective trauma over generations, over the collective now, what we are experiencing, right? So this is research conducted by Creating Healthy Communities, and this is like the 5 main intersections within public health that they have found here. So I just wanted to briefly highlight this kind of information here before we head into our panel conversation here. Before we head into the conversation, does anyone have any questions? Good. Let's make sure everyone's on the same page. Let's see if I see anyone's hands up. Nope. All right, awesome. All right, so we are going to get into our panel discussion here. So I'm going to pose the question first to Nushette and then to Doug. And a lot of this has to center around racism as a public health issue within our own town of Windsor here, right? Because we always want to base it off of not only our own experiences, but how we can do better, right? So our first question here is, what events, local, statewide, and national, do you feel precipitated the Windsor Town Council's resolution? And I'll put the question in the chat if you want to see it.
Thank you, Cassie. So in thinking about the resolution and why it was put forward and the timing to that resolution, and I just want to make sure, can everyone hear me? Yes? Okay. So I think as I reflect, there has been a lot of dialogue over the last 6 months about, like, where did this come from? Why was it put forward? And while there may not have been incidents directly in our town that may have precipitated a resolution, there were definitely things happening in and around us. And as a town, we need to lean in and be conscious of what is happening and how it can also affect people within our town. So leading up to June 2020, so many things took place. We had Ahmaud Arbery, George Floyd comes to mind. Like, those are like big pointed situations that occurred that definitely you felt the ripple of that. People became a little more anxious. People were tense. As I've shared repeatedly, he's now 14. I have a 14-year-old boy who does not look like a little boy anymore. So living here in Windsor, I also have to take that into consideration when I send him out, when he goes out from me, not just here in Windsor, but when he goes outside of our town, when he goes out to other parts of the state, wherever he might be. The national implications that we saw definitely cause decisions to happen differently on the local level. So I understand, I've heard it, I've received emails from lots of people. I'm not trying to be a disruptor, but as a community, we have to take decision, be preventative, and just really want to take a moment to step back and evaluate and look at what is happening around us, and to ensure that we are leaning in and understanding how we can work together to ensure that if things arise in our town, we are ready to respond to them. I'll share this again, that shortly before the George Floyd incident that took place, a friend of mine, her son was out just being a child, and the police were called on him. Why? Why? I don't know the answer to the why, but clearly someone felt that he was just in the wrong place, even though that is where his parents brought him home to when they left the hospital with him 14 years ago. So that's my answer, Cassie, is that while nothing locally may have precipitated the resolution, there were so many things happening on the national level, on the state level, that prompted me to say to the rest of my colleagues, we need to do this. So that's my answer.
Absolutely. Thank you so much for sharing. Yeah. So really getting at how we can change our behavior, not seeing like, what came to mind is like, because I've heard and experienced some of those myself, where it's like, oh, not seeing Blackness as a crime, and how like we really need to unpack like how we treat one another. So thank you so much for sharing. Doug?
Yeah, thank you. First, thank you, Cassie, for facilitating, and Judge Washington and the Human Relations Commission for hosting this really important talk. And it's great to work in a community that can have these conversations, right? Because not every community does have these conversations, and it's really, really important. In response to your question, I will kind of answer a lot of these from sort of the perspective of a historical organization. And our role is to collect, preserve, document, and interpret the history of the community. And in this case, it's the Windsor community. And tell these stories that are really, really important. So we don't create history, we don't manufacture artifacts, but we try to collect things nowadays while they're happening, right? Because it's a lot easier to collect things while they're happening than it is to try to collect them months, years, or decades, or centuries after they've occurred. And so very clearly, and also as a local history organization, very clear the connection between nationwide events going on all around us and things happening right here in our community. As Nushette said, maybe there wasn't a particular incident that sparked it right here in Windsor, but you could see all of the observances after the the killing of George Floyd, that clearly it affected people here in the community and resonated with people in the community, that it was a reality for people here, and they understood why it was so important nationally as well. So all of those things that Duchette mentioned are really relevant to precipitating, as we saw it, what happened here. We tried to capture it in this exhibit panel to some degree. Probably left a lot of things out, but we tried to capture the essence of the moment in history, both the national history and this town's history, that were so important to people.
Mm-hmm. Absolutely. Thank you so much for sharing. So definitely coming as we are, just who we are in this moment, and being able to really understand ourselves is definitely crucial. Because I heard you were talking about how we collect the data as it's happening, and everyone's like, oh no, like there's so much going on. Like how can I really like be responsive? And it's like, nope, just come as you are, and we're gonna like live through history together. So absolutely, thank you so much. So for our next question here, we're going to really get on a more personal level. How did the events leading up to the town council's resolution affect you personally? And we're going to start with Nushette.
Thank you, Cassie. And believe it or not, I'm like really nervous. So excuse my manners. I did not thank Judge Washington and the Historical Society, the Human Relations Commission. I apologize. So please, everyone, I do have manners, just a little nervous, so forgive me. Okay, so Your question, Cassie, is how did it affect me personally, the events leading up to the resolution?
Yeah.
So really, for me personally, being a woman, being a Black woman, a woman of color, a mother of 2 boys. I have a 14-year-old and a 6-year-old. And for me, what I was experiencing and what I saw on the national level, and also being an educator in an urban district, I saw all of the pieces unfolding, and I'm like, oh my goodness, I really believe that there's this indictment that is out, especially for Black men, but also Black women. And it became very personal. I grew up in Windsor, something I'm very, very proud of. I've lived here all my life. I'll be 45 shortly. And I have just seen over time that while we are a diverse town, and we can definitely hang our hat on that, and we can, put a feather in the cap, but are we really embracing our difference? Are we taking time to understand it? I'll tell you a quick story. When I left Clover Street School and went to St. Gabriel's many years ago, graduated from St. Gabriel's, and as children growing up, we were all at the pool together, on the playground together. But somewhere between that transition, middle school to high school, I think that is where lines began to be drawn in the sand, where whether intentionally or unintentionally, people, I've always seen color, but you hear people say, I can't see color, right? But people, and let me rephrase that. I believe, you said use I statements. I believe that people began to see color differently. And you can see that play out as children. Why? As I mentioned before, we started to look different. Black girls, people thought that we were like, over-sexualized because, we might be developing differently and were shaped differently. So for me, it became very personal because all of the things that had transpired through the years started to come back up to the surface. Things that I had taken much time to try to stuff back down because I wanted to continue to believe that the euphoria of where I grew up, this diverse place, we're just diverse, we're diverse, but not always accepting of difference. So that is why this resolution really impacted me, and I wanted us to put it forward, not to check a box, not to have all these different events, and there's nothing wrong with events, but I wanted us to challenge our mindset, take time to pull it apart, rip the Band-Aid off, and whatever the pus and ooze that was sitting there for years, get it up and out, so we really can say as a town that not only are we diverse, but we're welcoming, and we are challenging ourselves to address racism in any shape or form.
Absolutely. Yep. Being diverse, not only in mindset, but in action. So I definitely think that we will be able to move forward from here, but it does take a lot of work and time. So absolutely. Thank you so much for sharing. Doug, would you like to share your perspective?
Yeah, with a lot of these questions, there's your personal perspective, and then you put on your professional perspective as the director of the Historical Society, or a judge, or a representative of a school system. It's really great, I think, when your personal perspective and your professional responsibilities can coalesce. That makes for happier employees, right? when you do that. But Windsor Historical Society, certainly it is the case. And I think individual journeys in understanding, particularly as a heterosexual white male, might be an unusual person to lead an effort here to become a more inclusive organization. I have a good friend, also a heterosexual white person of a certain age, and she likes to say, "Well, I've been white for about 8 years." She's my age, of course, and she's always been white. But what she means is before that, I just thought of myself as regular. And so it kind of gets to this concept of what some people would describe as wokeness. I don't kind of see my personal understanding as this like light switch going on, aha, right? But to the question of how did the events leading up to the town council's resolution affect me, it was all these things happening that Nushette mentioned and we've talked about around the country. If people didn't understand why at that moment in time, it was so important to say that Black lives do matter, that people who have been systematically and systemically oppressed in a variety of different ways and feeling that, why it was important to enunciate that, yes, you can say all human lives matter. Of course they do. I spent time in Iraq. I saw prejudice against dead Iraqi soldiers by American soldiers. We have a cultural bias. There is no question about it. But at this point in time, all the events going on around us, it was really important to be able to say, Black lives matter, and stand up for that and stand for something important. And so that's how it affected me personally. I think it was clear that it affected many other white people in this community the same way. I walked past First Church every single day to go get lunch, and they had a huge banner in front of the church. And you saw that all over, not just Windsor, but many communities. And so I think it affected many of us in the same way.
Mm-hmm. Absolutely. Yeah. Kind of like having that moment where we are recognizing that, oh, this is a journey, a collective journey that we have to do together. Right. So absolutely. Thank you so much for sharing, Doug. All right. So now I'm going to open it up to the audience here, which is you all. So I'm going to call on two people who would like to share. You can type it in the comments, or you can raise your hand, just your regular hand, or you can raise your digital hand by clicking on your name, and then you can click raise your hand. And I encourage you to challenge yourself to speak up and speak out. So if you'd like to share your thoughts or opinions on the last two questions, I put them also in the chat, or anything that you're feeling right now. Go ahead.
Oh, hi, sorry. There's kids running around screaming, so I apologize in advance. It will get very loud very quickly. I just wanted to say the speaker, when he commented about his friend saying, well, I've been white for about 8 years, that very much hit me, because probably well into my 30s, I would have just said, I'm Caucasian, but my identifier would be like, I'm regular. And it does hit you differently to identify yourself as race, to identify yourself, as your gender identifiers, and to make that something that I regularly do, that I identify myself, because other people have had to do that for years, hits differently and it comes across differently. And for that part, it's made me notice so much more. When I watch TV, when I watch commercials, I've seen so much more. Not that it's where it should be, but I see so much more. I'm sorry, kids. But I see so much more representation now. Like when I watch commercials and stuff, I see Black families, mixed race families, Asian families. It's still not where it should be, but I don't know that I would have noticed those things 10 years ago. I identified myself as regular, and everything I saw on TV represented me. So I'm so grateful for the conversations that are happening. They force me to examine my own bias, and they make me so much more aware of what I'm seeing, and so much more able to process it and know how much further we have to go. I'm sorry, I don't know that was really constructive.
Awesome. Well, thank you so much for sharing. Yeah, because we're all really on our own journeys to not only understand ourselves, but those around us. And I see someone here in the chat said, great conversation. As always, helps me learn more about myself, hearing others. Yep. So really being introspective. Excellent. Maureen, I see you have your hand up. Go ahead.
Yep. I wanted to relate a story that I can, you said something that you viewed with your own eyes. So I've recently retired, and I'm very aware that the kids across the street are in and out with their friends, and they're parked out in front of the house with their loud music playing. and they sit in their cars for hours. I don't understand why they sit there with their cars running, but they do. And I'm not shy about going over and just talking to them. I said, guys, I'm right across the street. I get to listen to your music all day long. I said, I don't mind if you keep it down low, but personally, it's interrupting on my personal space. And they're very respectful. They turn the music off, they turn the cars off. And one day when I was having a conversation with them, this was over the summer, and their mom happened to pull up. And she pulled into the driveway and she came across the street and she said, are the guys being misbehaving? I said, no, they're just being kids. They're sitting in their cars with the music playing and the cars are running. And I've asked them to just turn the cars off and turn the music down. I said, we can all learn to get along in the sandbox. And she made a comment to me. Now, I just want to mention that this is a family of color. So she made a mention to me that she appreciated that I did not call the police with any incidences like this that involved her kids. She said, because I'm fearful. I'm fearful for what the police might do if they come down here and have to deal with the situation. And I thought, how sad as a mother that she would have to tell me that. Because I had teenagers, I had boys, I know what they're capable of. They would be in my driveway, in and out of the driveway with music playing loud and in and out in their cars and their friends coming over. And if somebody had approached me with that same situation, I never would have thought to tell them to please don't call the police. And I thought that was an experience for me. And I think every time I see the kids out there, I think of her comment. It's sad. It's sad that she's worried for her own children.
Mm-hmm. Absolutely. Thank you so much for sharing, and especially for that moment, because not everyone would think twice. They're like, oh, well, like you just kind of act based off of impulse or your own understanding. So but by sharing that, it shows that, oh, well, like, they're just being kids. I don't see them as a threat, right? Seeing black men as a threat and black women.
They're just being teenagers.
Mm-hmm, exactly. Yep. Absolutely. Yeah. So, and that's one of the ways that we can take action is by unpacking our own bias, because that really impacts the way we treat one another. And that small moment there became something bigger, right? Meaning, oh, we could not only learn from it for ourselves, but we can have a beautiful moment where it's like, this is a part of the journey that we're going on, like to understanding how we can be there for one another as a community. So I appreciate you sharing that so much. All right, so now we're going to move into our next two questions. I'm going to start with Nushette, then go to Doug. And feel free, you can type in the chat. I see some more people here are typing in the chat as well. I see Tim wrote, interestingly, I have been aware of my color since attending elementary school about 50 or so years ago. My school district was desegregated, so I was bused about an hour away to help balance school populations. Although the schools were more diverse as a result, we certainly did not socialize much after school due to living so far away. So I have been white for 50 years at least. Yeah. So seeing how that time stamp is very different based off of like the experiences that we've had and the people we've met and everything that's happening around us. So thank you so much for sharing, Tim, and sharing in the chat. Excellent. Awesome. So we're going to move to our next question here. So the next question for you, Nushette, is why is this declaration of racism as a public health issue important to you?
Thank you, Cassie. So the declaration is important to you. Important to me. I was reading what you put in the chat. It's really important to me because I do believe that it pulls in so many components that intersect. And as the videos that were shown earlier, as well as the slides that you put together with the definitions, there's so much that comes into racism as a public health crisis. And so the resolution for me is super important because we do need to take time to look at policies that are in place, hiring practices. And now I'm talking about Windsor, right? So bringing it all the way home, looking at policies that are in place, hiring practices. As we look across our town, going all the way back, thinking about how lines are drawn across our town and where people believe like, okay, well, that's the southern end of town and those folks live down there. And I've even heard them referred to like that, like, well, those folks. And I'm like, nope, they're Windsor citizens just like the rest of us. So that's why this declaration is super important to me locally. On the state level, as a state, the state of Connecticut continues to lag in the education, the achievement gap. It is startling, right? And so what are we doing? One more time, looking at policies and practices. You know, why are more brown and tan students are more chronically absent than their white counterparts? What about access to healthcare? What is going on with housing rights and applications for housing? Why is it that all of a sudden, you know, Section 8 vouchers seem to be on the rise, and it depends on timing? All of those pieces come into play for me. On the national level, it's much the same. What are we doing about policies that are impacting communities of color? Why is it? I was reading that book, The Color of Law, and for so many years, we have redlined. We have intentionally put brown and tan people in a situation where they can't even earn to buy a home where they would like to. So for me, that's why this resolution is so important. And it's for Windsor to really look at our hiring practices. I did ask our town manager a few months ago, like, can you tell me what the makeup, what the demographic is of people working in various parts of our town structure? And looking at those numbers, yeah, it did make me a little bit sick. It really did make me a little bit sick. So I want us as a town not to think of this resolution as something that overnight we're going to do all these like wonderful things. I think this is a great conversation. We need to do more of that, but we have to look at what is really happening, the systems, the structures that are in place, and how do we take time to dismantle piece by piece. And it's not something that's going to happen overnight. And you're going to keep hearing me say this throughout our conversation tonight. I'm after mindset. We have to change our mindset as a people. And Nichette has to change her mindset. Cassie has to change her mindset. So for me, that's why this resolution is important. It's super important because we have to pull it apart, see where we're falling short, and rebuild. I will add this last piece and then I'll be quiet. I know the buzzwords are like diversity, equity, inclusion, but they're only words if you don't have any action behind that. They're only words. If you can, go through a diversity, equity, and inclusion training just to say, oh, well, I did it. No. What are you taking away from that? How are you going to put it into play? As a group at Hartford Public Schools where I work, we have been reading that book, How to Be an Anti-Racist. Well, yeah, that's work that all of us have to do. I have my biases. I have things that, I have a prejudice towards. So those are things that I have to work through, that all of us have to work through. So it's super important to me because that's what I want us to do as a community, is pull it apart, like get in there, take it down. Like, when you're remodeling a house, they say, take it down to the studs, and then rebuild it. And I think we'll be better for it. But that's why it's super important to me, because it's years of hurt, years of hurt. You think about the GI Bill. When those GIs came home, they were already cut out. Their economic earning was already minimized because they weren't afforded the same opportunities. So it's years of generational poverty, not because they weren't contributing, but because they were discriminated against. They could not, their earning power. And so here we are again, that the earning power of Black and brown and tan people continues to be diminished. Re-entry laws. We've had policies passed for petty crimes, right? We think about the drug war. We sent so many people to prison, but now that they are coming back into society, what are re-entry laws saying? Why is it that some have different access points than others? So there's just so many intersectional pieces with this resolution and this declaration on racism as a public health crisis. So I'm sorry, a little passionate about it, but for me, it's just It's super important to me because I have two legacies, right? And I need to ensure that for them, we are trying to find a way to rectify this and find ways to change policies that for them, at least they have an opportunity. At least they will have an opportunity to see the world differently.
Absolutely. Thank you so much for sharing. Never apologize for your passion. It's awesome. Like, we appreciate you for who you are in this moment. So thank you so much for sharing. And just to really highlight that we really do need to redefine this as a community together and take that action. It's one thing to have the words, but then you have to actually have like bystander intervention. That's an action, meaning that are you going to do something in that moment, right? Like Maureen shared before, saying like, look, I changed, I did something different, right? How are we going to do that in each of our small moments, right? Because that was her small moment, but then I might have a different small moment in how I act, right? All right, so Doug, your turn.
Yeah, no, thank you, Nishette, for laying that out. And I was counting on you to do that so well. I want to look just a little bit at kind of the historical part of it. And, you know, this is clearly something that probably would not have happened in Windsor had it been brought up 6 months before, right? Or a year or 5 years before. So it really is a response to what's going on in the world around us, national events, and an acknowledgement at the local level that, yeah, these are valid, right? These are here too. These are happening in Windsor. So it's that response, but it's also, you know, why is it important? Because it can also potentially be a catalyst for future action. And so as a historical society, you know, we try not to get too involved in real controversial things, right? We like things to be very clear and very, you know, not safe, if you will. But so the fact that the resolution passed the town council by a vote of 9-0 suggests that there was a lot of unanimity in understanding those things that Nishette just articulated, right? However, what does it mean to, you know, it could mean different things to different people. And so I think it's very interesting, it will be interesting to see what happens in the future. How much of a catalyst for future action will this prove to be? And how will people view some of those actions that come after the declaration? So, you know, as a historical organization, we felt this is a good time to try to capture the importance of the declaration. And less importantly, but also nice, because Windsor is Connecticut's first town. We were the first town in the state to make this declaration. The first municipality, actually. So that includes some of the bigger cities where you might have expected to see something like that earlier. So it's really a great element of town pride. And of course, historical societies are great for trying to boost town pride. So we saw it as important, and I'm not trying to trivialize that in any way, but that it's important for a lot of reasons. And I mentioned that to some friends at different points. And I said, you know, it passed unanimously, and Windsor, you know, it was the first municipality in the state to do so. And they said, well, do you think it's a statement that the town is really ready to acknowledge some of these things, and that's why that happened? I thought that was really good analysis from somebody outside of the community, but looking in, thinking, you know, yes, this is a very diverse community. I live in Wethersfield, and there may be 80% white and 20% non-white. So they're not quite at that, what I would call the tipping point, where the white population hasn't yet really acknowledged some of these things about their own community that maybe we in Windsor have done a little bit more clearly. So that's kind of a historical and sociological observation about the various communities and how they respond and responded to this situation.
Absolutely. Kind of highlighting what you said there is that change takes hard work, and it takes everyone working together, right? It's really a journey of itself, where we have to constantly question, constantly say, like, how can we really be there? So thank you so much. Kevin, I know you have another question that you'd like to pose here.
Well, actually, it's a thought and a question, Cass. Thanks. Sure. When I first moved to Windsor, which was 2014, and I became a part of the Human Relations Commission, and I thought it was quite funny. I was just a member and a commissioner, and I'm still just a commissioner, but I just thought it was funny to me how when I became the chair, how it was highlighted in a local paper as the first African American of the Human Relations Commission. I thought that was hilarious. To me, it was funny because a town that boasts its diversity, you wouldn't think that would be something that was outstanding, that deserved, notoriety. And since I've been chair, which is going on, I think 7 years, scary. It has been interesting to me that we tout this banner, but simple things like a mural on the courtyard in front of the library caused so much ruckus that it was crazy. And I know Councilor Nugent Black can speak to that. The arguments that went on back and forth with that was, kind of daunting, to be honest with you. A community that touts its, we're racially, we have a 50% Black, we have a mixed culture here in Windsor. We don't have any problems, and I'm not seeing that in my observation. I see problems and I hear problems. And ever since that I've been on the commission, it's not about being Democratic or Republican or independent. It's us being all as one as people, and to get rid of this health crisis. And that's what I've tried to instill in my leadership on that commission. With every activity, event that we put down, it's not about Republicans and Democrats and independents. It's about us as a people. If we're going to tout that banner of being, an equal society, then we need to recognize that and put all these biases and negative biases aside. So it is my question to you all, do you notice or do you realize the disparities within our community of Windsor? And Doug, to your point, I think the chairman of the Weathersfield Human Relations Commission is on. So maybe she could address that question as well. Thank you. I'll shut up now.
Awesome. So whoever would like to go first, Doug or Nugent, either's fine. I'm going to put it in the chat as well.
Well, I don't mind going first. I'll give Nugent a chance to think, if that's all right, Nugent. So to the judge's question, and it's really some content that I was thinking I would get to in some of the future questions, but about, do we notice things in this community? And I will just say that from the Historical Society's perspective, absolutely, this is something that we have been grappling with internally, certainly intensively over the past year, right? Having some very difficult conversations internally about the fact that we are an organization whose membership is 95% white in a town that is 48% white, that most of our collections, most of our buildings, most of our financial support comes from a small number of relatively well-to-do, prominent white families in Windsor. And what does that mean? And to the point of public health, one of the videotapes talked about social determinants of health, perhaps as a code. But I have a lot of friends in the public health arena who subscribe to social determinants of health. What does it do to your health as a person of color when you go to your local historical society and every picture on the wall, every exhibit, every program, all the houses that we own and interpret are owned by white people or were owned by white people. And in some cases, white people who enslaved people that looked like them in the 18th century. And how do we interpret that, if we even do interpret that? So, what does that do to somebody's health, their mental health or otherwise, over time? So we take it very seriously. We absolutely recognize it. And we're on this, I would say, much like one of the videotape speakers who said it's a marathon, not a sprint. We are on a path to change that here at the Historical Society in partnership with the community, because we cannot do it by ourselves.
Thank you, Doug. And yes, and thank you for giving me a quick break. I was able to tell the 6-year-old. So do we notice? Do I notice? Absolutely. I mentioned the information I asked the town manager just about employees in our town. And in looking at that, for me, I think one of the biggest disparities that I saw was just the lack of representation of my Latinx brothers and sisters. I'm like, unbelievable. It was very, very jarring looking at that, just not seeing it in this diverse place of Windsor. Another disparity for me, when I think about what happens in our educational sector, yeah, the data is there. I know as a town, and I'm going to go there and say it because I continue to talk about it, a few years ago when we had that equity and excellence research study, it put the mirror in our face. And I don't know if in that moment we were ready to digest all of it, but it's there. And bits and pieces, sometimes seep out. When we look at the discipline data a couple of years ago, yeah, it did reflect what that equity and excellence research study showed us. But in the moment, I don't know if we were ready to have such a conversation, but definitely see the disparities. And I do think with the events that have transpired in our nation over the last year, I think we are in a better place to start looking at some of those disparities and unpacking them differently through conversations like this. So definitely notice the disparities. Another piece, housing. In Windsor, there's a conversation all the time about housing, and is affordable housing something that we should look into in Windsor? And I often have to ask myself, and of course, checking my own assumptions, like, is affordable code word for something else? So those are disparities that I see, and that I know I'm not the only one that sees them. Thank you, Doug. Our boards and commissions. So there's many places in our town that there are disparities that are being noted. So I'll leave it right there. But yes, I think I might have a running list that I talked about colleagues about, but definitely, yes, there are some disparities in our town that definitely need to be addressed.
Mm-hmm. Absolutely. And before we open it up to the audience, I just want to really highlight what you said there about how we really need to understand one another from different perspectives, right? How we're not just one race, how we're not just like one class, we're an intersection of our race, our class, our gender, our sexual orientation. So sometimes as a multiracial person, that might be at the forefront of my mind more so than being like a woman, right? So it's always important to highlight those intersections. All right, I see that we have, but we're going to open it up to the audience now. I see Maria and then Deborah would like to share. Go ahead, Maria.
Hi, everyone. Gosh, there's so much in my brain right now. I want to explode, but I'm going to start what I heard kind of last. Just an answer maybe to Judge Washington in regards to like when he first moved here and Windsor boasts about how diverse we are and so forth. And we're so proud. I am one of those Windsor proud, as we all are. Windsor proud. I wear 06095 on my sleeve every day. And I think there are two trains going at the same time, right? So having been here in the 70s and in the 80s, having lived through those period of time, and then fast forward to 2021, heck yeah, we are diverse. And kudos to us, because compared to other towns, they're not as diverse. So that's where the proudness comes from, because boy, if you survived the 70s and the 80s in Windsor, whoo, you made it. It was rough. And I was just a kid. And so all of what's being transpired today in the light, you know, in headline news, that happened here, right here in Windsor. Like driving to school, while driving by Black to school is you're stopped. So you got to stop. You don't drive your car anymore. So you decide, I'm going to take the bus today because gosh, that cop is going to make me late for class. You know what I mean? So it was those, you know, those things that having been a student here during those years, but then again, fast forward today, we've come such a long way and we have made leaps and bounds compared to others. So that, I think that's where, you know, kind of like the pride comes in at that point, in comparison. And then something else that was mentioned, and I apologize, it might be a question or two ago, with Nuchet that, but I do want to say, I don't disagree with what you mentioned, Judge, you know, what was mentioned, those disparities do exist. So what happens with me was like, oh, let me tell you where that comes from. But you're right. You know, but when you sit down and you peel the onion, you're absolutely right. But, you know, we're still walk with the pride. Nuchet, you mentioned a little earlier on, you mentioned something about, although major events didn't take place in our town, but it may have taken place in our surrounding town. And I don't know. I think we just never heard of it. You know, I think that, you know, sometimes folks are just still scared, you know, to report things. I think intimidation, you know, this is like, you know, I'm saying the opposite of what I just said. I think the intimidation kind of maybe still exists sometimes. Maybe, you know, newer folks that move in and they don't know where to take things, or, you know, not familiar, you know, they don't have that relationship with their neighbors or the town hall, and you know, so where are they going to report it to? So I personally, if we start digging, you know what I mean? We're going to find something. So, you know, I just, that was really my statement. I'm just saying, well, you know, let me think about that, because even with me, my personal experience, and you mentioned after, you know, heels after heels after heels, what happened over the summer, you know, people became a lot more bolder, you know, like you're like, wait, is this my town? Like people were really bold, you know, like, so like I park in the grocery store and, you know, before, if somebody parked, you know, someone who was white might have parked, I may have never known that they didn't like my color because they just park and just go, right? Unless they're friendly, said hi or whatever. But, you know, when that period of time was happening, I was parking at Stop and Shop, and at least twice, you know, there were things that came out of those individuals' mouths because it was just them and me in that spot. But we all, you know, that could have been front page news, depending on how I dealt with it, right? You know, so in my mind, you know, I just closed my door, I grabbed my you know, my store bags, and I just walk in, you know, like, because for me, I'm like, I just don't have time. I can't, you know, like I'm tired. I just not, you know, for me, it was one of those not today days, you know, like I just really can't. So but, you know, could I have reported that? Could I have made such a really big deal about it? You know, could I have mentioned who it was? You know what I mean? Like it would, you know, so it does exist. I'm not sure that everyone, you know, feels comfortable enough to report.
Mm-hmm. Yeah, absolutely. Thank you so much for sharing. Because that's weathering in action, being like, oh, I'm so tired. Like, because our energy is precious, right? So to have that extra layer on top of it, being like, oh, like, do I have to do this today? Like, I'm already tired, like physically, mentally, emotionally, of like having to face this. So thank you so much for sharing, Maria. I see Deborah, you had your hand up. Go ahead.
Yes, please. Hello, everyone. I am the chairperson of the Human Rights and Relations Commission in Wethersfield. And speaking to the question about whether or not we see discrepancies in the claims of our town versus the reality of our town, first I would like to say I in no way want to bash Wethersfield. There are many reasons why I'm happy to be here. But I would also like to say that I think Windsor is light years ahead of us. The best way that I can explain, I think, what my experience in Wethersfield is that Wethersfield loves to claim that we are a diverse town. Well, we are. There are 30-something languages spoken in our public school. We have many different groups within our population, but diversity of residents does not necessarily translate to diversity in participation or recognition or respect or joining together. So this is something that a lot of us here in town have been working on for a while, and we intend to work on it as hard as we possibly can going forward. Wethersfield just started a social justice coalition, which I understand has been established in several other towns here in Connecticut. And you know, a lot of us joined in that commission thinking, okay, we're going to change things now. We're on the road. It's going very slowly. And we're realizing that we are probably going to be going forward by inches rather than miles, as some of us want to, but we'll keep at it because the work is so necessary. You know, I believe that Wethersfield is still at the top of the list, listed for towns that stop Black and brown people at traffic stops at the town line between Wethersfield and Hartford. That's not a distinction that I am proud of. It's not a distinction that should be held by any town. Judge Washington, you were saying that you thought that it was funny when this big deal was made about you being the first Black member of your commission. Well, Ryan Biggs has just been appointed to our town council, and he is the first man of color in that position. It was the same big deal. It made the papers. People were posting. And you have to ask the question, well, why is that? If we are truly a diverse and inclusive town, wouldn't that be just another piece of our day-to-day experience without being remarkable? So I guess my short answer is yes, Windsor is not the only town seeing discrepancies. We are too, but I'm looking to your town for leadership in combating it. So I thank you for everything that the Human Rights and Relations Commission is doing there. Thank you.
Thanks so much for sharing too, your perspective as well, because I think it's kind of like ironically here, because I remember looking into the history, because the Town of Windsor Historical Society has a phenomenal website and amazing resources. And I remember checking into it and I was like, oh, you know, historically back in the 16 and 1700s, before Windsor got broken up into different parts here, some of these other towns like Wethersfield, South Windsor, Windsor Locks, and some of the surrounding towns would look to our town to see, well, what are they doing and how can we be better allies and supporters to one another? So I thank you so much for sharing that, because change takes action and hard work. Everyone's like, oh, it's not just talking the talk, but it's walking the walk and struggling together, right? So thank you so much for sharing that. And the last question that we have here, in this section, before we get to a more historical perspective, is what do you hope may happen as a result of this declaration? I'll read that one more time and put it in the chat. What do you hope may happen as a result of this declaration? So thinking more of that action mindset. Nushette or Doug, whoever would like to go first.
Doesn't make a difference to me, Doug. I'm like.
You always do such a good job starting these things off, and I'm hoping Nushette has a lot to say about this, because we talked earlier about how this declaration, and one of the videos talked to that too. They said, hey, we just passed a declaration, celebration, right? Oh, wait, we still have a lot of work to do. It's the first step, not the last step in a very long process. And We're going through that internally at the Historical Society, as I just mentioned, in the community. So we're kind of waiting to see, honestly, from documenting what happens in this wonderful community perspective, what will happen as a result of this. Some things that have followed that along the same lines, we're directly involved with. Captain Mason's statue out on Palisado Green is one of those things. We certainly see a lot on social media about that. We certainly heard a lot at the town council meeting about that, and still do. The Indigenous Peoples Day resolution, and those were less unanimously adopted, right? So what does a 9-0-0 vote on this resolution mean when it comes to implementation? I think that's something we'll be interested in seeing, how this all plays out, and what does racism as a public health crisis mean to each different person as they evaluate that. So we'll certainly be interested in that. And just I wanted to say to Deborah Cohen, who is I don't want to say a neighbor of mine, because I'm not sure, Deborah, where you live in Wethersfield, but thank you for being here. I hope you didn't feel like I was bashing Wethersfield. It's where I live, and I love my town. Ryan and I served together on the Veterans Commission before he was appointed to town council. So it was a loss for the Veterans Commission and a gain for town council that Ryan stepped up to council, absolutely. But it kind of points out, as you just did, with firsts, right? Firsts are a double-edged sword. It's great to be first, but then everybody watches you to see what do you do next, because you're out there in front of everybody else. If you're the first one winning a race, people are all eyes on you. Nobody's watching the guy at the end, right? Or the person at the end. So it is a double-edged sword, and we'll be interested to see what becomes of Windsor's effort.
Thank you, Doug. So James Baldwin, like I love to read his materials, love his quotes. And one of the quotes, when I think about, everything that has taken place, and one of his quotes says, "It is certain in any case that ignorance allied with power is the most ferocious enemy justice can have." And you're like, what do you mean by that, Nishad? And for me, what I want us to do and what I want to see through this resolution is that the word ignorance, yes, it sounds strong, but if we have a lack of knowledge, a lack of understanding, a lack of knowing, then that is what I want us to do first. And I think conversations like this challenge our ignorance to a certain degree, and gives room for us to learn differently. So that's like the first thing I want to see from this resolution, is that we continue to learn, continue to gain knowledge, so that any ignorance that's there is dispelled. The second piece for me would be to see the true diversity of our town represented in every area, on the school board, on our commissions, everywhere. When I walk into the town hall, then I'm like, okay, I see myself. I want my sons to be able to see themselves, wherever it is that they go throughout this town, that the scales aren't unbalanced. So for me, that's what I want to see. I want to see, not just in word, but in action, and how we operate, true diversity of thought and diversity of who's around us. And I think the third piece for me that I want to see from this resolution is that we have a continuous effort to challenge each other to be a welcoming Windsor, a Windsor for the people, that we will stop thinking that one end is better than the other end, but we will actually find a way to connect. Doug, I know that our 300th anniversary is coming up soon in our town? Four, okay. So I'm hoping that between now and then, we would have covered some groundwork to look at our rich history. How is it that our forefathers contributed I'm West Indian. How did the West Indian culture, the tobacco workers, how did it all come together? You know, how did my Latina brothers and sisters contribute to Windsor? That is what I'm hoping that this resolution will do, is that we will take all of our history, put it together. And Maria, I think you are absolutely correct. I am a Windsor girl through and through, but I want every part of Windsor to be represented, not just in, oh, it's Windsor, but I mean everywhere. I would love to walk in our town hall, and I love the pictures of the Shad Derby, but I would love to see just artifacts, relics of each stage of our history displayed in our schools. So for me, those are like the three big things that I would love to see come out of this resolution. And for me, yeah, that's it. Another James Baldwin quote, and I'll be quiet, is that nothing can be changed until it's faced. And we're facing this as a town. I applaud us. Ms. Cohen, thank you so much for what you said. You're right. You know, many towns, people have reached out and said, what is Windsor doing? We want to know what Windsor is doing because you guys were the first to do it. Well, it's uncharted territory. We may have got some things wrong, and we're definitely trying to get some things right. There have been so many things that have happened. I love that the community wanted to have a conversation about our forefathers, Major Mason, the indigenous people. I love that we had a mural. All of those things, while they weren't born out of the resolution, but they were there, and our community wanted to address them to make us a better Windsor. So that's what I want to see out of the resolution, a better Windsor, and I know we can do it.
Mm-hmm. Absolutely. Thank you so much for sharing. So it's kind of seeing how we ourselves are the solution, but we really do have to be in this together. Because I'm a correct teacher, so the saying this year is we're building the plane as we're flying it, right? So we gotta work together, because we don't know how we can drive on the road or fly the plane if we don't work together to build it. Because we are really in this together to understand how our actions will help us with where we are at now and for future generations. So thank you so much, Nushat and Doug, for sharing. Now we're going to kind of understand how history fits into racism as a public health issue. Because when you look at this from a historical perspective, you can see that disparities have been and continue to be here over time. So what we're going to do first is we are going to watch a short film snippet, and then we're going to head into a couple of background slides. Thanks to Windsor Historical Society, I kind of took some of your information, put it on some slides, and then we're going to have our second set of questions, okay? All right, so I'm going to share my screen. If you can give me a thumbs up once I share it so that you can see it. Awesome, great. Glad you're seeing it. Okay, here we go.
Hello, my name is Yvette Young. I am the Associate Vice President of Programs and Advocacy at the Village for Families and Children. The reality is that Black individuals is a part of American history, and so it makes sense to me that they're a part of Connecticut history. There are a lot of individuals in Connecticut history that are African American, that were born and raised here, and those who migrated here from the South, and they played a critical part in the history of Connecticut and in the life that we all live now and know now. There are many activists and many individuals who shaped our society and our community. So to talk about the history of any state or any nation, you must talk about the contributions of Black individuals in those communities. One of the individuals that really stand out to me that I wanted to share is Mary Townsend Seymour. She was born in Hartford, Connecticut in 1873, and she died in 1957. She was a female activist for her time. She was one of the Black suffragists in the state of Connecticut who worked with the national movement in 1919 to ensure voting rights for women, but also wanted to ensure that Black women were included in that dialogue and that Black women also received the right to vote. And so she motivates me because activism is a huge part of what I am passionate about and the work that I want to do. And to see a figure like that in such an early part in our American history, and the fact that she was so successful in all her ventures motivates me to want to continue to do the work that I do to advocate for the civil rights of those that continue to be disenfranchised in our communities. The one thing that I would want to see change is for the passion of the people to create equity to continue, and for it to move from just vocalizing disdain towards a level of hate and discrimination to actual action. I want people to stay woke. I think that's, in summary, what I would say. I want people to stay woke. I want people to realize that the work is continuous, it's hard, it requires a lot of commitment, and as long as we each play a part, and as long as we each contribute a bit of what we have to offer, change is possible. So as a Black woman who lives in Connecticut, it means a lot to me, because it means celebrating the ancestors that came before me, celebrating the people whose shoulders I stand upon to be able to have the privileges that I have currently as a Black woman in this country. And so for me, it's personal, because it is my history. It's the history of Connecticut, but it's my history as well, because without women like Mary Townsend Seymour, I wouldn't be where I am right now. I wouldn't have the ability to vote. I wouldn't have, the ability to have a voice and to continue to advocate for what is right and just. Surging through my blood are the legacy and the ancestry of those Black individuals who fought before me. And I want to be a continuation of that work. So Black history in Connecticut, Black history in this nation is the foundation upon which I stand.
All right, so that was our third film snippet here. And I just really want to highlight here how we have, we are really approaching right now the intersection of history, racism, and public health. So simply put, it is understanding how our roots impact current issues around race and health. All right, so in this next conversation, we're really going to focus on that. We got to watch film snippet number 3, and I'll put that in the chat soon. Whoops, I get click happy here. All right, so when we look at the main historical events at Windsor, Connecticut, this is a very, very brief, we have like almost 400 years of history. I know at the Windsor Historical Society, they do more of a holistic job of going through each of the hundreds of years. So this is just my interpretation of like some of the history here. So if you look in the 1600s, in the town of Windsor, there were people coming over from England here, taking of the land from indigenous people in the Pequot War. Then they started tobacco fields leading to the state of Connecticut through colonization. In the 1700s, there was we were contributing to the system of slavery with reformation of church and state. So that was back when the church and state were like together, and they held the economy together. Then in the 1800s, there was a cultural divide with the Civil War. And a fun fact here is that Connecticut, everyone's like, oh no, like you were in the North, so everyone's all on board. Historically, if you look at it, actually half the state was on board. The other half was like, nah, not cool, man. Like, I'm not about this, right? So even as a state, we were divided here. And then if you go to the 1900s, we are still socially divided going into the next era here with the civil rights movement and technological changes. Technological not only in culture and language, but also as we are progressing within the digital era. And finally, we are up into the 2000s where we are transforming ourselves into understanding who we are now. Right, so this is very, very brief, okay? I'm not doing like an all-encompassing history here, but you can definitely check out some of the resources that the Windsor Historical Society has. So when you look at the demographics of Windsor over time, this is kind of like the breakout of the statistics put into some words here, right? So it's predominantly white up until like the 1800s. The only people of color were slaves. They were the people, they were the servants, they were the people who did the work, right? So it's like, oh, we stole your land and now you're gonna do all our work. But sadly, because of the different diseases that were brought over, not many of them survived, right? So then over time, like we can kind of see how it then changed. Oh, well, you know, church and state got separated, a lot more things happened. And now we have segregated spaces in the 1900s based on race and ethnic origin, right? So now we are getting into the 2000s, which is where we are currently at. And this is getting into how we are integrating spaces with centralized pockets on race or ethnic origin. So this is really sharing the story of, well, how did we get so diverse? How did we get here? Did we just build a rocket and fly far away? No, it's like this happened over time, and it happened for a reason here, right? Whoops, keep clicking ahead a little. So I have 3 points on the Windsor demographics, right? So the 3 main points here are the economy, community opportunities, and climate. So when you look at a lot of the qualitative data here, as in what people are saying as to why they're coming to Windsor, a lot of them are like, hey, there's some jobs here. You can have more economic opportunities to grow your wealth and income. There's community opportunities, you know, like coming to great events like this from that the Windsor Human Relations Commission puts on. There's a lot of different ways that people can connect. And finally, the climate. No, I'm not talking about the weather. I'm talking about the way that we treat one another, right? Even though we have a long ways to go as a town, it is better than other, I shouldn't say better than other communities, but people feel safer in some parts. And we're gonna kind of get into why or why not people feel that way. And finally, the climate of Windsor really influences who we bring in, right? So the energy that we have here with one another is what either negates or attracts people to come to our town. So we have a shift in race here due to culturally relevant spaces, meaning like, oh, I feel like I can belong. And that is important, not just to me as a millennial, as like a millennial of color, but also because it's like, oh, I can be myself. I don't have to put that mask on, right? There's this language and behavior where I can feel accepted and wanted. And again, we're all growing through this together, right? So this language that is changing over time. We used to say Native American. Now that's retired and we say Indigenous people, right? Black Indigenous people of color versus people of color. Us versus them mentality. So really shifting our perspective and mindset over time. All right, so I'm going to stop here. I know that was a lot. It's often hard to, we have 400 years of history, so it's often hard to like condense it, but I highly encourage you to check out some of our history. Any questions before we move forward into our next set of questions? Good. Okay, awesome. All right, so for this next round, I'm going to say the first 2 and then I'll open it up to everyone else. So we're going to start with Doug and then go to Nushette. All right, so the first question here, because I know, Doug, you're actually working on a project here. Would you like to tell us a little bit about the project before I ask you some of our questions here?
Yeah, well, the project, thank you very much. The project is actually behind me here. It's done. We're not working on it, but we're continuing to, because it's our ongoing mission to collect, preserve, interpret the history. But we developed an exhibit panel in conjunction with the people actually involved in not only the declaration itself, but some of the events leading up to it, and captured that moment in time in one exhibit panel, which we have here at the Historical Society. I'm in the main lobby here, which is why it's so echoey with all this great graphic stuff behind me. But we also presented a copy of it to the town. And so the town has a copy of it that they can display at Town Hall, because we thought it was an element of town pride and also an opportunity to educate people about the situation and what came out of it. So that is there for folks in Town Hall to utilize as they would like to as well. It's certainly not the end of the story. The project, if you will, continues, and we'll get on with the rest of the questions.
Awesome. Thank you so much for sharing that. So our first question really has to do with this project here as to what kind of, what inspired or moved this project forward. So kind of what was that inspiration for this project here?
Yeah, that's a great question. And I'm sorry to be doing so much talking, but there's a project and there's a direction, right? And the 2 answers to the question. One is it is historically significant, right? And the other is that it coincides with our strategic direction as a historical society. But it's an interesting point because much like the town council would probably not have passed that resolution 6 months or 12 months prior to when they did, certainly you might not have seen this exhibit panel developed here at the Historical Society 5, 10, 20, 30 years ago, and maybe not as quickly after the event as this was developed. So there's some reasoning behind that. And I've talked a little bit about our own internal efforts. And one of the things we are attempting to do is to do history more inclusively. And that's just a broad way of saying that becoming a more inclusive organization is not a matter of honoring the accomplishments of Black individuals during Black History Month and then checking a box, right? It is looking at your entire organization and how you do things, how decisions are made, who is involved, whose story you're telling, and whose voice is telling those stories. So that's all part of doing history more inclusively. So this organization started 100 years ago. We're about to celebrate our 100th anniversary in September. And you can't do this work without being inclusive, without engaging the community. But the question is, who has been engaged and who is included and whose voice is telling the story? So up until not too long ago, much of that was about our white founders collecting objects that belong to white people and essentially interpreting it through a white perspective. We're trying to do better. There's a lot of work to be done. And I'll talk in a couple of minutes about some of those ways that we're manifesting that, but just a very quick point about this exhibit panel. And this was done, I think, as inclusively as we could at the point that we did it. So it's always hard to get busy people to want to participate in designing an exhibit panel. So we didn't sit down with all the participants and say, what would you like to portray on this panel? What we were able to do, thanks to all the people that contributed to this, we collected photographs and speeches and statements made at town council meetings from real Windsor residents. And then we bounced it off them again and said, hey, is this what you said? Is this okay if we incorporate this into the story? And everybody said yes, including Nushette Blackburn, who is here with us today, and several residents as well. So they had direct input. They had an opportunity to say, no, that's not what I said. Don't use that or whatever. And so we tried to do it as inclusively as possible to really portray it through the eyes of the people who participated in the events at the time. So.
Absolutely. Thank you so much for sharing. So I heard that, Nushette, you got to be a part of this as well. If you'd like to kind of share a couple of thoughts and feelings as to what's that was like.
Thank you, Cassie, and thank you, Doug, and the Historical Society for wanting to really capturing this moment in time. I believe that there is such power in storytelling, and I think that exhibit does exactly that. It tells a story. And while I know, even if we did not have the exhibit, what happened in town between the beginning of June out on the town green to the resolution being passed at the town council meeting, that would have been passed down for generation to generation, but we have captured that story in real time. And so, yes, I think having that exhibit panel stamped as a moment in time that will be a part of the historical record of the town, I think that is absolutely what needed to happen. Because I think Doug is correct. If this were a year ago, maybe not, but we had to capture this moment. And what more powerful of a way than to do it in the form of storytelling? So I appreciated being a part of that. And Doug and his team, yes, they were very diligent, making sure they wanted to represent your voice and wanted to make sure that as it was shared, it's what you wanted it to be and what you wanted to be put forward. So I do applaud that, because they could have just said, okay, we'll just take some footage and go from there. But storytelling is probably one of the most powerful forms that we have. And truly it was captured by that exhibit.
Mm-hmm. Absolutely. And it's really nice to be able to see how we can connect or relate or find these ways where it's like, oh, I've had a similar experience or I've had a different thing, and how we can analyze that over time. So thank you so much for sharing here. So our next question here before we open it up to the audience is, what steps is the Windsor Historical Society doing to move towards recognizing the contributions of African Americans in Windsor? And I'm going to pose this question in the chat as well here for everyone. So what kinds of steps are you taking, Doug?
You know, there are some great people who are here on this video chat with us who are a part of this effort, right? Because it's not something you do by yourself. You can only do it in partnership with members of the community and your existing members, board, staff, and everybody. So many people who are here are part of it. And you know, I could give you a long answer or a short answer, and I think the time allows us only time for a short answer. So I'm going to read you two things, because over the past year, we've been involved in developing first an inclusion action plan in conjunction with the Minority Inclusion Project. Many people know Jamal Jimerson, and several were on that committee who are here on this call today. I won't call them all out. And then that was folded into our new strategic plan. And so our principal strategy puts inclusion at the center. You know, you see a lot of strategic plans, and being more diverse is like objective 13B, right? Oh, we're going to be more diverse. Oh yeah, and we're going to be more diverse. So strategy number one is to be first in our region to center our history and culture on the lives of racially and ethnically diverse members of our community. That's job one, to use the old Ford motor car expression. Our inclusion action plan begins with a preamble, and I'm just going to read you one sentence from that preamble because it conveys what we aspire to do in partnership with the community and how we view our role in the community going forward. It says that Windsor residents, past, present, and future, are holders and tellers of their experiences, their truths, their values, and their town. So that powerful statement is what will guide our direction moving forward as we begin our next century.
Mm-hmm. Absolutely. Thank you so much for sharing. And Nushette, what's your perspective on the steps that the Windsor Historical Society is taking for African Americans in Windsor here?
Thank you, Cassie. I know I've had many conversations with Doug in regards to work that is being done at the Windsor Historical Society. And what I will add is that I appreciate the manner in which they are taking the time to honor the contributions of African Americans here in our town. It's a rich history, one that deserves to be told and should be told. From Nancy Toney all the way to Arch Memorial, and just such living history there. So I applaud them for doing that work and would ask them to continue that. Most recently, my neighbor who loves so much, Windsor High graduate, was named to lead the ACLU. She is from Windsor. She is from this soil. Lived here, spent lots of time, worked tobacco like all of us Windsorites. Maria, did you work tobacco? You know, Debbie Archer, did you work?
Lasted a day.
You know, so, you know, thinking about Deborah Archer, like where would we put her in the scheme of things, Doug? I don't know, but honoring the contributions of African Americans to this great town is one that we have to definitely continue to build, applaud, and the Windsor Historical Society is leading that charge. And I just applaud them, Doug, the board, for just taking that up. So I'm looking forward to see all the different pieces that come together. And I'm sure all of us will be better for it. And again, storytelling, it's powerful. Have you been to the Windsor Historical Society lately? I mean, it's like amazing in there. So I just appreciate all that they are doing.
Excellent. Thank you so much for sharing. Yeah, being able to connect over such rich history. All right, so now I'm going to open it up to you all here in the audience. So if anyone would like to share, I'm going to try to call on a couple more people here. Oh, I see Maria, Florence, and then Agnes. Go ahead. Maria? Oh, you muted. We can't hear you.
Florence and Agnes can go first because I already
Okay.
went.
Awesome. Okay, sounds good. Florence, go ahead. Oh, we can't hear you. You got to mute.
Hi, everybody. I can't believe how many people here that I know. And you know what's the neatest thing of this? For such a time as this, I am so excited what is getting ready to happen in Windsor, Connecticut, because Maria, I was back here in the 70s, and we've had first Black girls in the Shad Derby. I was first Black on so many organizations in Windsor. I don't even want to go there. But you know what I've learned is that we as people need to talk to each other. Everybody here who know me, we need to open up to each other and just talk about things. Someone said to me last week, one of my white friends, she said, I didn't know Black people had did that many things. I said, well, you have to wait until the month of February to find out this. It's always been there. You just have to find out. So I'm all excited about all the things that are going to be happening at the Historical Society. And Agnes Peer and I are sort of in charge. So we're going to be going through the entire town of Windsor, looking for people, Black, brown, and white. I said to Cheryl Curtis yesterday at the Arts Center, I said, we're looking for Black and brown people because we have lots of white people. So we're going to be getting this town together, this diverse thing. I started out with Ebony and Ivory. There are people here probably who was part of that. Okay, back in the 70s, and we always was proud of being diverse. But to be honest with you, and I'm talking to people of color, if you don't come out and be part of it, that's your problem, not mine, because I've been trying. Cassie, I've known you since you were a baby.
Yeah.
You know, we worked at all kinds of things together when you were a little kid volunteering. So it's really, it's easy for us to sit here and make comments, but really our people need to get out. I'm talking about my people. They need to come forward because they're here. You know, we have in the Atlantic area, we have very well-to-do people of color. Nobody know they're there because they're not involved in the town. I mean, back in the days of the Shad Derby, we actually had girls running whose parents didn't attend things because they did everything in Hartford. So I'm not pushing the blame on all people that are white. You know, I think it's time for us to come out. So anybody who's on this tonight, tell them to get in touch with me. You know, anyone in Windsor, I would love to get more people of Black and brown involved in what's coming forward in the town of Windsor. So thank you all for doing this. This is very exciting. I'm looking forward to it. I wish I was about 30 years younger. Thanks, Cassie.
Oh, thanks, Florence. It's great to see you here. All right, now I'm going to turn over to your friend Agnes here. Go ahead.
Yes. Yes, Florence, and we remember way back in the 70s. I'm one of those transplants that adopted the town. My family adopted the town in the 1970s, 1970 when we first moved in. So it's been 50 years. And one of the reasons why we chose to come to Windsor is that my husband and I were coming from St. Louis, and we actually worked within the inner cities of St. Louis. So we were very much involved with social justice. But what I want to say is going to be a spin-off of a little bit of what Doug tried to explain that the Historical Society is doing. Because one of the things that in our planning and trying to get this going in strategic planning and in the inclusion group, the thing that we thought about was that this thing that's called diversity, and then I've listened to all of you guys say disparity. We have disparity. Yes, we still have disparity in Windsor. You know, all my children went through the school system. Yes, we still have disparity in Windsor. So what it comes down to is words are cheap. Actions are the only thing that really counts. And in trying to look for, I'll go all the way back to our search for our executive director. because back then we were, which was what now, a year ago, maybe almost a year ago, we had already begun and had been thinking about we needed to do this, but we needed somebody who could really help move that forward. And when we did that and we got Doug, what ended up happening was all those lovely words the Historical Society that has said with number 6 on their strategic plan for a lot of years, we're going to become a more diverse organization. We started walking the talk. And that's what I think is really important. And going forward, that's what we're trying to do is, yeah, we know we have disparities. Yeah, we know there's racism there, but we can't just say it. We have to say, what can we do about it? And so that's my piece that I'm saying is that, and that's what we're doing in the Historical Society, is that we're trying to walk the talk. And yes, Florence, Anna, and I are teaming up together to help plan and lead the 100th celebration for the Historical Society. So many of you are going to hear from us. Just know it. Many of us are going to hear from us.
Absolutely. Thank you so much for sharing, Agnes. All right, before I go back to you, Maria, I see there's one more person, or is it okay if I get one more person, Maria?
Yeah, absolutely.
Awesome. Okay, I know you don't mind. That's what I was trying to ask. Awesome. So Stephanie, would you like to share? Go ahead.
Hi, thank you so much. I hope you can hear me okay. I just want to say that I think the best step that we can take is to just keep talking about this. My son, he's 11, just came in the room. What are you doing? And I said, I'm on a workshop right now. I described briefly the nature of what we're discussing. And, you know, he's going to go back and he's going to talk to his friends. I texted a friend just now. I said, I'm on this Zoom call. I texted my mom. And so those people are going to go back and they're going to talk to other people about it. So I think the best thing that we can do is just to keep talking about it. And I just want to go back also to something that was said earlier in the call, and that is, you know, kind of the surprise around acknowledging, you know, a Black person is the first person in a specific role, or a person of color is the first person in a specific role. I actually think that's very important to highlight, because it almost makes us think like, well, why is it now that it's the first time someone is in this role? I'm the president of the Windsor Little League, and you know, throughout the year we recognize important milestones and historic events. Specifically in February, Black History Month, I was, you know, quick to acknowledge certain things that happened in history. One of the events being that the Negro League only in December of 2020 was recognized as part of Major League Baseball. And I was very eager to say, yeah, this only just happened. Because I think it takes everybody a step back and makes us wonder, why is this a big deal? This should have happened already. And I think it just speaks to the progress that we're all involved in making. So thank you very much for hosting the session.
Thank you so much for sharing, Stephanie. All right, I see 2 more hands up here, and then we're going to move on to our final 2 questions. So I see it's Maria and then Jane. Go ahead, Maria.
No, Jane, go ahead.
Oh, okay. I wasn't sure. I never know.
No, Jane, go ahead. Okay. I had the floor like 3 times already. So
okay. Go ahead, Jane.
No, just quickly. Tonight, I think it was you, Cassie, that said it's not about being the same and making us all the same, but it's really celebrating our differences.
Right.
And opposites do attract. So that just really hit me. We passed 2 of our 5 laws this week. 2 were very important. Some of you may have heard about the Crown Act. And people were saying, why do we have to legislate that you can't be discriminated against because of your hair? Right? And when those that were watching knew that Representative Porter and several Black women were beat up pretty bad because of their hairstyle. And so when it went to the floor, there were 12 people that did not vote for it. And one had stood up and said, well, back in high school in the 70s, I had long hair. And even though I was a white man, I was discriminated against and people made fun of me. And we all went, aha, that's why we need a law. So, that was a really, it was a moment. The second one was, which I didn't even know this law existed, that people 20 years ago, I could have gone on welfare for 2 years. I might have had a baby or my parents might have died, whatever that was. And so then what would happen is you get on your feet. It gave you that boost that you needed. And 20 years down the road, you bought a house, you're making it, you've gone through school and you go to sell your house because you're retiring to Florida. The state would take back the amount of money they had given you plus interest. So what would that do? For many people, that would put them back into poverty and start the whole cycle. So we did pass a law that will no longer happen. How many knew that was happening? I didn't know. Right. So as everybody was talking, I relate a lot to music, and the song that came into my head was Bob Dylan, The Times They Are A-Changing. And I took a quick moment to look it up, and it means what I think it does. And with all the chaos and all the past 4 years of feeling like you were in a constant storm, earthquake, ice age, and everything all rolled into one, I see so much happening here in Windsor to move forward and to lead. I see so many people in our community like Duchet Black-Burke who are, taking the reins and showing tremendous leadership and giving us all the strength to move forward. And I hope this is the time that the times are changing and that together, the more we understand and can do, that change will finally really come.
Mm-hmm. Absolutely. Thank you so much for sharing, Jane. All right, go ahead, Maria.
All right. Well, mine's going to be real quick. It's more or less I'm sharing. I think Doug will appreciate this very much. Doug, you don't know me, but you will get to know me because, the Windsor Historical Society, every time I drive by, I'm like, I want to stop. I want to stop. I want to stop. And this has been going on for years because that's what interests me is, history and so forth. It's always been easier for me to walk into, a historical place in another country to learn about blah, blah, blah. For some reason, it always was hard for me to walk into the Windsor one because it gave me anxiety. Because I did not know, I'm like, what am I going to walk into? Like, what am I going to walk into? And I literally would get anxiety. And then, I think this summer, there was all like this sale, estate sale. I'm like, well, this is my time to go park. They're outside. I can go and I can just drive by. I'm like, but I didn't because still it was that level. And I don't want to find out this and this and that. And I know that I'm not going to see me in there, and I love my town and I don't want to taint what I know about my town. So that was my level of anxiety. So, when you're not sure, I was registered for this conversation because I wanted to be here. And then something happened. I'm like, okay, well, I meant to be there, but something pulled me to come in here. And now I know why I'm here. And it was all because to learn about the Windsor Historical Society and what all that is changing, and whoever is looking for whomever, you're looking for, people of color and so forth. Well, guess what? You got a twofer because I'm an Afro-Latina, so I can bring you not only the Black version, but I give you the Latino version of being an Afro-Latina living in Arrowbrook Road in Windsor in the 70s. How's that?
Write down her name, Doug.
So Doug, now I'm going to be a frequent visitor. You're going to be like, oh no, it's her again.
That's great. All I'll say
I've
is
already written her name down.
you missed some great bargains by not coming to our tag sale.
Awesome. Thank you so much for sharing, Maria. And that kind of gets into our last two questions, which for our session today, which I'm going to put right here in the chat. And it is, what notable African Americans have been identified for their contributions to the town, both past and present? And what's being done to preserve that legacy at the Windsor Historical Society? Because I see there's this beautiful project that you have here, and there's like so many different things changing and happening, and we're all like really getting to bond over here. So what's being done to preserve it, and how can people be a part of this? Doug?
So I know we're short on time. I'm going to say that I know some of you know the names Nancy Toney, but you may not know the name Betty Stevenson or Sarah, who were also enslaved people in the same Chaffee House. So you probably want to learn more about those people. You probably have heard of Representative Joseph Rainey, his house here in Windsor. You probably heard of police officer and municipal leader Bill Best, but you may not have heard of Moses and Oliver Mitchell. You may not have heard of Sandy Archer. You may not have heard of Beulah Winston. Those are a couple of the people. And all I'm going to say is go to our website, click on Windsor History, Windsor's Black History, and you'll see some really cool resources, not the least of which is a phenomenal thesis written by Marcia Hinckley, who's here on this call, back 30 years ago. Who knew? It was sitting here in our library in paper copy, all right? Now it's digital, it's on the website. You can read so much interesting history about Windsor, Black community, and some of the buildings and things that are still actually intact still, you can go see them. So that's what's one of the things that's being done. Go to the website, you'll see a lot more as well.
Mm-hmm. Absolutely. Thank you so much, Doug, for sharing all that information. And then finally, Nushette, how can people be a part of all of this history we're living through and being a part of now here?
Thank you, Cassie, and thank you, Doug and Judge Washington, everyone who had a hand in putting this together. I really enjoyed tonight, really enjoyed tonight. But Florence Barlow, who's so full of wisdom, when I even first considered becoming involved, you know, she's one of those people who's like, just get it done, you can do it. And that's what I want to say to people is, get it done, you can do it. Anything that you can contribute. If it means that you just go to the Board of Education meeting and you offer a statement on something that, you know, you want to share, to applaud, or even to offer ideas on how we can address an opportunity, you can get involved that way. We have a listing of boards and commissions that you can find on our website. Lisa Bress, who is also on this call, who is the chair of our personnel committee through the Windsor Town Council, you can reach out to her, reach out to any one of our counselors or our elected officials. Just know that you have a place. You know, for many years, we've been talking about having a seat at the table. Well, I'm here to tell everybody, listen, chairs are open. Grab a chair, take a seat. Grab a chair and take a seat, and don't feel intimidated. I was just that parent. I was that squeaky wheel parent that was always harassing the Board of Education for something or the other. And that's how I got involved. So all I'm saying is to everyone, be a part of the history that's being made in our town by taking time to share your voice, lend your hand. You know, there's a saying that says, to whom much is given, much is required. So much has been given to us and much is required of us to continue to push and see the change that we want to see. And be the change that we want to see. So that's all I have to say, Cassie, is get involved.
Awesome. Thank you so much. So now this final question is for everyone here. If you'd like to share any final thoughts or feelings in the chat, maybe what's an action you want to take after being in this conversation space. How are you feeling? All right. So while you are all talking or typing away in the chat, Kevin, I know you have some announcements.
Yes, the Windsor Historical Society and the Town Council put their bid in. I just want to also put my bid in that there are open positions on the Windsor Town Human Relations Commission. We would love to have you. And Mrs. Bress would be grateful to interview you for me. And Nugent Black, Councilor Nugent Black, she will be lucky to talk to you as well. So I'm just putting my bid out there. I thank each and every one of you for being a part of this conversation. It was a special conversation. We were winding down to the last few hours of Black History Month, but Black History Month is not limited to 28 days. Black History Month goes 365 days a year. And I meant to say, I can't wait. I hope I'm here in 50 years or a fly on the wall to read Councilor Nugent's Black Burke's history. When I hope I can come back and fly in as a fly or something, because I'm sure they're going to make a bust of you. And maybe you'll be right there where James Mason was, whatever his name was. How about that? I did have a couple of announcements. We are going to also continue another special conversation, and then we're going to take a break, a 2-week break, and then we'll be back on the 14th, because starting tomorrow is Women's History Month. And on March the 14th, Davida Pafoy Crabtree will be leading a discussion with us on Women of Connecticut. We will also look at the contributions of Women of Windsor. One of the ladies that Councilor Nugent Blackburn talked about, we're considering honoring as a phenomenal woman of Windsor. And that will be also March 14th from 6 to 8 as well. The second one is being led by our own bridge builder, Miss Maria Rodriguez Furlow. Raise your hand. She will be leading us in our One Book, One Windsor conversation. It will also be from 6 to 8 on the book, How to Be an Anti-Racist, and also Stamped, S-T-A-M-P-E-D, by the same author. So if you want to pick those up at the Windsor Public Library, they have several copies. They have audio copies of both books. So she will be leading a discussion on that with us. And that's all I got to say. That's enough, isn't it? Oh, and don't forget bridge builders. The applications are posted to the town website. If you know someone that's deserving of a Windsor Bridge Builder Award, please go there and fill out the application. Again, I thank you all for being here and participating.
All right. Thank you, everyone, and have a good night.
Thank you.
Thanks, everybody.